Hey guys, this is Dr. Clay Sankey, chiropractor at TruMotion Therapy in Charlotte. And in today's video, we're going to talk about how you can optimize your sleep position when you are in pain. Now, there's nothing more frustrating than not being able to sleep because something hurts. Now, sometimes things just hurt, and they're going to hurt. No matter what you do, no matter what position you lay in, it just nags at you. But what I'm gonna try to give you are some strategies to help take the edge off, or at least keep the thing from getting worse. Because oftentimes there are little tweaks that we can make that make sleeping a whole lot easier and more enjoyable. So hopefully we'll provide you with some information that can help. Now, I can't hit on every pain syndrome in the body, but we're going to try to hit on most of them, or at least most of the body parts that can cause us trouble when we're sleeping. And we're going to do so with each sleep position in mind. So side sleepers, back sleepers, and stomach sleepers, we've got something for all of you. All right. So we're gonna start with side sleepers. All right, so if you're sleeping on your side, you're typically gonna want a thicker pillow. That's gonna help support your head a little bit better than a thinner pillow. Thinner pillow, you're gonna be all crunched up. So sleeping on your side, thicker pillow under your head, and we'll typically want a pillow in between your knees. Having that thicker pillow under your head that keeps your spine in a neutral position is going to help with shoulder pain, it's going to help with neck pain, and having that pillow between your knees can be really good to help take some of the edge off of the hips and the lower back, okay? If we don't have that pillow here, people tend to sleep with one leg in front of the other, and that can just put more strain on the back than we want. So that's the ideal setup for side sleepers. Oftentimes though, we'll get people complaining of elbow pain and wrist pain, and they don't realize that what they're doing when they sleep can have an impact on those things. Because what we'll typically see is you're sleeping on your side and you have your elbows and wrists curled up just like this. Well, if you've got elbow pain, having your elbows in this position all night can leave you with achy feeling elbows in the morning. So typically what I'll have people do is take another pillow and just hug that in front of you, okay? That just keeps your elbows in more of a relaxed position than up like this. Okay, so hug that pillow out in front of you. If you're having a hard time with that, keep them between your legs like this. If you're really having a hard time keeping your elbows from being in this position, you can slide your arm in through your shirt, straight jacket style, and that'll keep it by your side just like that. Okay, so that covers most people who'll be sleeping on their side, keeping your neck in a neutral position. If you have neck pain, headache, shoulder pain, putting a pillow between your legs. If you have hip pain, lower back pain, and then hugging that pillow just to keep your elbows and wrists more relaxed if you're dealing with things like carpal tunnel syndrome, tennis elbow, or golfer's elbow. All right, now we're on to back sleepers. So if you're a back sleeper, the pillow under your head should be a little thinner than if you're a side sleeper. A thinner pillow is all that's needed. If it's too thick, it's gonna push your head forward, can cause some discomfort there. So thinner pillow under your head, and then I usually recommend a pillow under the knees as well, okay? That pillow under the knees is just gonna help take some of the stress off of the lower back. And if you continue to feel issues in the lower back or the hips, just start adding some more pillows until you start to feel more comfortable. So same thing goes with the side sleepers. If you tend to keep your hands up like this, hug a pillow in front of you, or stick your arms through your shirt, straight jacket style, if they're causing discomfort at night. But that's the typical recommendation, typical setup for back sleepers. So thinner pillow under your head, pillows under your knees, and then if you need that hugging pillow to take some of the pressure off the elbows, that's a good idea as well. And lastly, we're on to stomach sleepers. Now, we typically don't recommend people sleep on their stomach because in order to do so, you typically have to turn your head like 90 degrees to breathe, and that puts a lot of stress on your neck. But if that's the only way that you can get sleep, that's totally fine. Don't stress about it. If you're sleeping well and you wake up feeling good after a night of sleeping on your stomach, I think you're doing just fine. But if you want to optimize your sleep position, or if you do sleep on your stomach and you do wake up feeling pain, try these recommendations and see if they help. So we either recommend a very thin pillow under your head or no pillow at all if you're a stomach sleeper. Now, we say stomach sleeper, but typically people like to actually sleep at a bit of an angle. So what I'll have people do is have pillows, a couple pillows or a body pillow under you, one that you can rest your leg on, and then one that keeps your torso at a bit of an angle this way. That way you're not 100% on your stomach, right? You're giving yourself a bit of a break from having to turn your head all the way to one side, and you're just relaxing just like this. So this would be a good setup if you're sleeping on your stomach, to take some of the pressure off your neck, your hips and your back. And if you do want to eventually transition to your side, this is a good way to do it, because you can start stacking pillows up and eventually work your way onto your side, which may be a better sleep position for those with neck pain or back pain. So I hope that information was helpful. If you're experiencing any kind of pain in your body, whether it's related to sleep or not, we would be happy to help you out. Please visit us online at TruMotionTherapy.com to learn more.